Hello, happy Friday. Welcome to one of the, I won't say last episodes of From Belly to Baby, but at least from this portion of the program. We are here with Dr. Shelby Dickison, who you were here very early on.
Yeah, it's my third time here.
Mm-hmm. Well, week 14, 15, because everything's about me. Sorry.
It is about you. I'm surprised you're here.
It's the map. Well, you know what? I said I would do it through this point for sure. Next week, we'll tell you later in the episode, we do have a very entertaining episode planned for you next week, if I'm still here. And I can't decide yet whether or not I want to still be here. But I've kept saying I went 38 weeks in like 3 or 4 days, somewhere in there right now. And I keep saying I've been hoping for a solar eclipse baby on the 21st, because I was born on the night of a lunar eclipse. I'm like, wouldn't that be an exciting story?
Super neat.
But now I was just sort of the other day saying, you know what, if
I
you
want to be
came
done.
earlier.
39 weeks.
Okay, 39 weeks, it's fully cooked. But today we were talking, so last time, we had you here a couple weeks ago, we were talking about what happens in the delivery room. The first time we had you on, we talked about healthy habits and fitness and all that stuff. And now we're talking postpartum.
Oh, a lot of stuff. I'm bringing it all together.
Yes.
I'm bringing it all together.
You absolutely are. And it's so funny because a coworker of mine once said, it's amazing to me that we tell women all of these things that are going to happen during pregnancy.
And ignore the back end of it.
And then you deliver that baby and there's all this stuff that happens, including, taking care of another person, but you're never prepared for that. In addition to that, your body is still changing.
Yes.
Once that kid comes out.
Oh, completely. It's called the 4th trimester.
The 4th trimester. So the fun doesn't stop.
We should have had the 4th trimester as the title.
We should have. Well, we talked postpartum brain last week, which is a huge issue. And
it is.
This week we're talking postpartum body. So we're just going to go head to toe, all the things you can expect. And I am so completely clueless on this. We have our good friend Laura, who is behind the camera, who is a mom of 3, who can pitch in questions as warranted or reality checks. And of course, please type your questions into the comments. And I will say, I'm still at the point where I'm having trouble. Like, my lung capacity is just not there. So we'll hope that you can, whenever I sound like I'm going to just pass out.
I'll take over. I'll take over.
Fabulous. All right, so 4th trimester. Let's start right up here.
Head to toe.
Head to toe. So hair. And I will say, everyone told me your hair when you're pregnant is so amazing, blah, blah, blah. I don't buy it, not for a second. I don't think it happened. I changed shampoos, and I think that did more for me than pregnancy hormones.
You're buying better stuff for yourself.
Yeah, because I feel entitled. But after the baby is born, one of my friends said, you have to address the fact that your hair falls out.
Oh, yes. Oh, yes.
And it happens regardless of whether you notice a change in thickness and growth while you're pregnant?
No association. Yeah. No association. It's called, the scientific word is telogen effluvium. Hope I said that right.
That is, you know what? No one here is going to contest it.
Anyway, what happens is during pregnancy, your hair gets stuck in the same spot during its growth cycle. So all of the hair does. So in a non-pregnant individual, your hair, different follicles are going through different levels of growth. And so you're losing different hairs at a different rate. But then in pregnancy, and I really don't know why, to be honest with you. If anybody out there does, please let me know. It starts going into the same growth cycle. It kind of stalls.
Okay. And
so then after delivery, 3 months after delivery, the first 3 months, maybe 4, you may start to notice that your hair is falling out. I assure you, as long as you're not having balding in one area, it's more of a diffuse loss, and it can be very, very dramatic. And what happens is you are losing your hair all at the same time, and you're not used to that normally. And it may come out in clumps whenever you're washing your hair in the shower. I've had some people describe losing it on their pillow when they wake up in the morning. It's more of a diffuse loss. And it's just because your hair is in the same cycle during pregnancy, so you lose it all at once after delivery. Okay. But then after that 3 to 4 month period, that slows down. It may take it a little bit, and you will notice that it will curl less and less.
Is that why the mom haircut? Is that why women actually cut their hair after they have babies, or is it because of the pulling?
It's because the pulling.
Yeah.
The pulling of the baby's
pulling
the
her.
busyness,
Yeah.
and you don't want to take care of it.
Yeah, it's true. Yeah, it's easier. Unless you can just ponytail it or sock bun it. Either way.
Hey, I do that a lot too.
Yes, I'm a big fan. I can't wait for the hair to get long enough for the sock bun again. So we've got hair covered. Let's talk about skin.
Skin. So during pregnancy, certain individuals, not everybody, and I really don't know why certain pregnant women develop this, but they may notice the mask of pregnancy. I don't know if anybody's talked about this yet on your episodes, but you may notice darkening of the skin, okay? Like on the cheeks. The very, very common area is along the belly.
Why is that?
So you have hormones in your brain that basically, for various reasons, to bore you all the very, very scientific details, will stimulate melanocytes, and they will produce melanin, and that's what gives us our skin color, along what's called the linea nigra.
Yeah.
That will get better over time, I assure you.
So that line goes away?
Yeah, that will go. And you may notice after a couple months it kind of rubs off.
Oh, how weird.
That's more with you losing skin.
Okay.
All right?
That's wacky.
Or within your belly button.
Uh-huh.
So now the mask of pregnancy may stay a little bit longer for those who do have that.
And does that slough off, or does it just sort of
it will
evolve?
fade over time. Yeah.
Okay. So you're not going to be losing part of your face.
Yeah. No.
Good to know.
Yeah.
All right, and then
so don't freak out. I can erase it off.
That is so
very,
weird.
very common. Women ask me at their post. Like,
Those magic erasers are pretty special. So we've got skin, eyes. I know that when I went to the eye doctor a couple of months ago and I had to get a prescription updated, they were saying, well, maybe you just want to hold off until after the baby is born. And I'm so baffled by this, but a friend of mine who was breastfeeding, she was a couple of months postpartum, said that she had some peripheral vision issues, and then you're not recommended to do anything drastic like LASIK or whatever until you're finished having children.
Yeah, that will continue to happen with each pregnancy. And the reason why is during pregnancy, as you already know, you retain fluid.
Oh my gosh.
Yes. You retain
Yes,
fluid. You may be wearing flip-flops a lot.
I can't lift my feet up high enough to show off the fabulous flip-flops that I am wearing right now, but at least they're stylish.
You may notice carpal tunnel. And because of all of the edema, it can cause your vision to be blurry. Wait until after delivery to have any further evaluation for that. It's reversible.
Good to know. Okay. So moving on down, there was an article I was reading the other day, and it could just be about, how active you are during pregnancy, that a lot of women during pregnancy lose upper body strength. But I think the explanation was just that you weren't working out to the same degree or doing things to the same level as before. Do you see that in patients?
You know what? It's not a common concern that women have brought to me, but it does make sense. You are limiting the amount of exercise. Not that you should, but sometimes it's just hard to keep up that level of exercise that you were doing before.
Okay. And now we get to the good stuff. Oh, wait. First, let's go hands, because you mentioned carpal tunnels, and I was telling carpal tunnel.
Oh, yeah.
It started just this week, and it's at 38 weeks. I have trouble gripping a steering wheel. My handwriting doesn't look nearly what it used to because I can't hold a pen correctly.
Yeah.
And it's not so much painful as it's just
Weakness.
really, really uncomfortable. And it's hard functionally.
Yeah.
But you said that's fluid retention?
Yeah, same deal. So your wrist has a lot of connective tissue that basically everything channels into your hand, nerves, muscles, and because of that excess fluid, there's a lot of pressure within there, and so the nerves tend to take a hit. It's reversible though. Yeah. So there's really, other than you can get wrist splints, and you can use them at night or if you're typing a lot to kind of help with that, but it may take up to 6 weeks after delivery to start noticing improvement in those symptoms.
And you said you had that experience?
Oh, yeah. Operating in the OR, I could tell. I didn't necessarily have weakness, but I'd have tingling in my hands. But some individuals may have weakness, and it's completely reversible. So.
Gotcha. And now we get to the good stuff. I was hopeful that we would have at least 5 minutes of conversation before we get to the let's say chest to knee area or chest to thigh area. But here's the department in which no one prepares you for anything that is going to happen, but I am told it is dramatic and it will never be the same. So let's talk about breast changes. Obviously they change during pregnancy.
Yes, they change during pregnancy. And some of the stuff I'm going to highlight upon, I'm sure they've talked about it like in the breastfeeding episode that you had, but just like with the linea nigra, you may notice your breasts to be darker, especially around the areola. That's normal.
Is it really so the baby can find them?
Well, evolutionarily, that's what we think. That's what anthropologists think. They can really see it and then hone in. Sometimes you may not want them to. You may be running as well. Don't run, your baby needs it. We can help you through it. But yeah, one of the anthropologists think it's because that's really what the baby can see. And so you may notice your areola to become darker. That will get better over time. And then the other thing is when your milk comes in, you may notice, in addition to engorgement, but a lot of veins. A lot of veins. It will get better.
Is it just a blood flow thing?
Yeah, it's a blood flow thing. Okay. Increased blood flow to make milk, increased metabolism. When you're lactating, you burn up to 500 calories a day.
The ice cream is going to be so delicious.
Continue lactating if you can. If you can.
That's what someone once, I heard someone describe it as just like, this is great. It's like I have a treadmill strapped to my chest at all times.
Where's that baby at? I need to lose. I need to run. I need to do my running.
Exactly. I'm going to sit here and run for a little while.
Yeah. And I'll watch TV and talk on the phone. Maybe. Or just look at my baby. Either one. But so, it's just that increased
and does that continue while you're throughout breastfeeding,
it's
or is it just
slow
initial?
Initially, because you're breastfeeding so much in the beginning, that slowly gets better over time. Because you're not breastfeeding as much as you start introducing solids into the baby's food.
Okay. Well, and unfortunately, I guess at that point you have to adjust what you're eating as well. But I just one reminder for people, because I've heard it from so many, about how much water you consume.
Oh, goodness. Same reason. Yeah. Tons. About the same as pregnancy.
Okay. Very good. So when you're finished breastfeeding, let's say 6 months, a year, whatever your goal and objective was. Yeah. Does everything go back to where it was supposed to be? I know the answer is no.
So you may have stretch marks. You may notice that your breasts are, what's the word I should use? Wimpy. I love
Laura's just doing this.
They may not be as firm or perky. Just because the baby's stretched everything out, just like what the baby did when it was inside of you.
Oh my gosh. So yeah, about that. Once you get, so let's talk about the stretching and the morphing back, which the belly as well. So we talked about the line. And the other concern I know a lot of people have is stretch marks. So if you had stretch marks, do they fade?
They will fade. Oh yeah, they will fade over time. They don't necessarily go away, but they will fade.
And then what happens? And this is just, I can't wrap my
You're
mind
trying
around
to
it.
see.
What happens once, okay, because this is out here, the belly is out here, and the baby comes out. What happens to that? I mean, because it can't possibly just right back into place.
Yeah. I had a patient, it was the night before. It's all gone. It's all gone. The uterus is still there. So initially you're going to feel so much relief because this watermelon is now outside of you. And you're like, oh. But now what you've noticed, it's a loose watermelon. And it's going to be a little floppy, particularly after delivery. You still have that uterus that is yay big that needs to clamp down over the next 6 weeks. And
6 weeks? Takes 6 weeks to go back to normal?
The first 2 is when a majority of it, but some patients take a little bit longer.
All right.
We'll talk about the 6-week visit
towards
the end.
Okay.
Or I'll bring it up.
Very good. Very good to know. Like I said, this is all new information for me. It's very eye-opening. I'm sorry, I completely interrupted. So it clamps down.
Yeah, the uterus. And so you may notice that you're still a little floppy because that uterus is still there. It's about yay big. But over the next subsequent several days, it'll get smaller and smaller. And if you end up having a C-section, or whoever else has a C-section, they may use an abdominal binder to help with that because they have a scar down here, and that uterus will pull away from that I shouldn't say scar, not yet, but incision. But as that uterus goes down, you're going to notice, wow, there's a lot of room, like a trampoline, only not as firm as a trampoline. That's because all of the connective tissue that's in your body had to get stretched out for that baby, and it really takes time for that to firm up. beyond the 6-week postpartum visit that
Okay.
you're supposed to see your OBGYN for. Months, maybe even a year.
And does
maybe
that
never the same.
anything to do with the muscle separation as well? I'm going to mispronounce it. It's diastasis recti? Close enough?
Yeah, close enough.
Okay.
That's fine.
So the muscles, does that happen in everyone? First of all, let's go to what is it?
Yes, great question. So your rectus abdominis is the medical term for. Can I?
Yeah, absolutely. Kids moving over this way, just so you're belly. Can I
Yeah,
borrow your
can I borrow
belly?
your belly?
You bet. Okay.
So the rectus abdominis runs like this, 2 strips, just like that. You have other muscle layers as well, though. Your obliques, internal, external, and then your transversus abdominis. There are other muscles that make up the abdomen. But if you look, the rectus abdominis has to take the biggest stretch to get over that belly as it comes out this way. Now, what happens is because of that, you have a layer of connective tissue called we call it the fascia, but it's the fascia or connective tissue of the rectus abdominis. And as the belly expands, the rectus, it stays about the same but gets pushed to the side.
Okay.
And so because of that, you may notice after delivery, I had a patient tell me this once, this just doesn't look right. What's that big lump? And it basically was a separation of her rectus with underlying fascia underneath.
Gotcha.
And so you may notice it tent up in the middle. It's more of a tenting. That's the best way I could describe it, that you'll see that you never had before. That'll get better over time. Some patients will have pain, and I'll refer them to physical therapy for that.
And does it take, can you start exercising again at some point, or in doing crunches or things like that to help improve it, or is it something that you have to really let heal for a little while?
It really depends on the patient. Some patients will spontaneously regress and do fine. Other patients may require, I say physical therapy because they target specific areas that are beyond crunches. Crunches will not help with that. And crunches could make some of your pelvic floor issues worse. And we haven't even talked about the pelvic floor.
We're getting there. We're
What
very
time
close
is it?
moving to
It's only 4:15.
Okay, good. But they can guide you through other exercises to really tighten up the fascia that's underneath and the obliques, which are on the side, that contribute to the diastasis that you may see. Okay. So it's really beyond the rectus abdominis that you need to target. It's more the transversus abdominis muscle. I'm talking all these big words. Other muscles besides your abs that will really help with that situation.
Sorry, the kid's doing a dance, which is why I'm fidgeting. It doesn't have anything to do with you showing what's going on. So if you've had a C-section, are there other things you need to take into consideration in terms of how, because you're slicing, with the C-section, you're cutting through muscle, correct?
Well, we try not to.
Okay.
We try not to. The idea is to just go through the connective tissue and not the muscle. Now, if it were an emergency, or maybe from a repeat C-section, you may have scar tissue, it may warrant that, but we try not to. We try to go in between the 2 recti to get into the belly to get the baby out. That's ideally the situation. Now, women with C-sections, you'll have an incision down in your bikini line, and that abdominal binder will really be your best friend for pain control. But also in helping you really stabilize. You may feel a little unstable, which goes for vaginal deliveries as well, just because of the looseness that you feel from the delivery process.
Okay. All right, so I think I have covered everything possible before we get to we'll call it the pelvic floor area.
Pelvic floor, yay!
So let's say in your perfect world, you mentioned ideally you go into labor on your own and you have a vaginal delivery and everybody's good at the end. So once the baby, we had an off-camera conversation about this afterwards. I had to be educated about certain methods of how the baby's going to emerge and what it's going to be stretching out in the process. So you just squeezed a baby out of an area that is not that big.
It's not that big.
So how does that come back together?
So what's very interesting about
Do tell.
the end of pregnancy, but then also the delivery process is it can stretch. It can really stretch.
It's like Gumby.
It's like Gumby. It's got to get 10 centimeters. 10 centimeter. My head's a lot bigger than that, thank goodness. But I learned something over time.
It's getting scarier. But
I know, I'm sorry. The baby's head is about 10 centimeters, okay? And that's how we determine when you're complete or not, and to start pushing, or wait and then start pushing. And the delivery process, and then also the end of pregnancy, it's a really slow process, which really helps that bottom, we'll call it the bottom, be able to stretch.
Okay.
There's a lot of congestion, which is good, congestion fluids.
Okay.
Discharge towards the end of pregnancy, which allow everything to mold and allow the baby's head to come out. Okay. Now, at the time of delivery, if you have a tear, your delivery person, OB/GYN, midwife, will put it back together. Okay.
Stitches, right?
Stitches, yeah, stitches. We'll put it back together. And because of it, but even in people who don't have tears, there are still some longer term consequences that may happen because of getting the baby out. Okay. So common complaints after delivery would include the following. We'll just go with the most talked about one, urinary incontinence. Okay. Up to 25% of women will have urinary incontinence after delivery.
Like what level of incontinence are we talking about?
That is some.
I guess it varies. Okay.
Yeah, so that is some or any, and then that will vary. Okay. Some women will just have incontinence immediately in the first week after delivery. That will get better over time. Others may be incontinent over their first couple of months, and that will get better over time. Some women may have long-term problems with incontinence after delivery. Okay. The immediate, so the first week after delivery, some risk factors for urinary incontinence would include prolonged pushing, so a lot of pressure on that bladder for a long period of time, or an operative delivery, okay. Particularly with forceps.
So that's the operative is the forceps or the they look like salad tongs.
Yeah.
And the vacuum.
Yes, those are both considered operative deliveries. The forceps are more associated with that. You have different risks associated with each of those methods, and an OB may choose to use one or the other based upon several different things. But urinary incontinence is more common with the salad spoons. Salad
You are welcome. Is there anything that can lower risk of those interventions being necessary, or is it at that point is just get it out?
Well,
safely.
Yeah. So there was a study done that looked at pelvic floor physical therapy during pregnancy and during after delivery. And there is some benefit associated with that. But
are we talking just Kegels, or are we talking
beyond? This is Kegels on steroids.
Okay.
So Kegels was developed in the 60s by, somebody named Kegel was his last name. And basically...
His mom was so proud.
And his mom was so proud. It was basically devised to help strengthen the pelvic floor or the muscles that surround the vagina, essentially. And they surround the vagina, they surround the urethra, which is the tube that drains the bladder out, and then also they surround the rectum and the anus, which is the bottom part of the rectum. Okay, the pelvic floor muscles help control us peeing, us having bowel movements, but also are involved in orgasm, may contribute with pelvic pain, and we'll talk about that in a second. Right now we're on urinary incontinence, but also help with the delivery process as well. So Kegel developed these exercises where you squeeze your bottom up, all right, to help strengthen those. And it may help with urinary incontinence as well. But what we've found is somebody giving you positive feedback. So there are physical therapists who specialize in pelvic floor therapy, are actually better than just doing Kegels. at helping to strengthen those muscles. But also sometimes those muscles can be in spasm, like if you had a cramp in your calf, and can cause pain after delivery. And we'll talk right now on urinary incontinence. But and so a pelvic floor physical therapist may be somebody that your OBGYN would refer you to help control or help improve urinary incontinence if you have that after delivery.
Okay.
So like we talked about, some immediate risk factors would be prolonged pushing, or would be the salad spoons if you have them.
If I apologize if you wind up having to use that in your practice.
But that will normally get better over the first several days to a week after delivery. And then vaginal deliveries are more associated, at least immediately, with urinary incontinence. But we haven't really, there may be some baseline just pregnancy stuff that can be associated with urinary incontinence as well.
Okay. So urinary incontinence, and you mentioned pelvic pain being
Yes, exactly.
residual.
So up to 50% of women may have dyspareunia, that's the medical term, or pelvic pain with intercourse.
Okay.
A lot of that has to do with your pelvic floor muscles being in spasm. And the forceps are associated with that as well.
Okay. Couple of questions related to that. And let's start with, so what general rule after baby is born is how long before sex? 6 weeks?
We normally,
Whatever.
yeah,
I know
so
it's
we normally,
patient, but-
yeah. After a vaginal delivery, we want to make sure that any tears are healed. I mean, it's going to cause you more pain, and it could break down that tear as well. So we just want to make sure that's healed before you attempt intercourse.
And we talked about this in the breastfeeding episode, but I think it bears repeating because I don't think there's a person alive who doesn't have a friend who has, or at least knows of someone who has found out they're pregnant when they thought, I am breastfeeding. How is this possible?
Yeah.
So you can get pregnant.
Yeah, you can. I'm glad we're talking
postpartum.
about that. Yeah. If you're not breastfeeding, it can occur as quickly as 27 days after delivery.
Wow. Which is when every woman wants to learn that she's going to go through this one
One
more
more
time. Yeah.
2 to 3 months, this is not breastfeeding, 2 to 3 months is on average when women start ovulating and start having periods and can get pregnant. But remember, you can get pregnant before you start having your period, okay? Because you have to ovulate before you get pregnant. And women who breastfeed, they can use what we call lactational amenorrhea as a form of birth control. The failure rate's like anywhere from 1 to 6%. But basically, you have to be 24/7 breastfeeding, greater than 85% of breastfeeds in the first 6 months after delivery. We can help enhance that if you're not doing that with what we call progesterone-only pills, which are safe in breastfeeding.
Okay, so there are birth control methods to talk to your physician about if that's the option you want to choose.
Or implants, you can get them in the hospital. IUDs can be inserted within 10 minutes of delivery.
What?
There are higher rates of them expulsing though, and so we will typically in my practice do it at your postpartum visit.
Gotcha.
Which will be at 6 weeks.
Okay, fascinating. All right, anything else about the lower region that we need to discuss before we move on to legs?
Bleeding.
Oh yeah! Oh my gosh, the bag of gifts one of my friends sent me.
Oh,
is
yeah.
Impressive. There's,
Pads
I never knew they
the
made pads of
Perineal.
that size. So the
we've
got.
I did.
I wish we could see the gestures that Laura's making. She's
I
like,
should have.
This big.
I did a class at the children's specialty building in October talking about your postpartum body.
Yeah.
And I brought in for that class the various items that you may need.
Oh, we could have had visual aids. It didn't even
I
occur
know.
to me. So the bleeding can go on. Well, first of all, what level of bleeding are we talking
Exactly. So after delivery, the first 2 weeks, that's when you'll experience the most heaviest type of bleeding, okay? And it may occur episodically associated with breastfeeding, okay? Or having some sort of letdown, because oxytocin that your body makes is associated with you being able to breastfeed. And it also causes your uterus to clamp down. And you may notice after breastfeeding that you may have an episode of heavier bleeding, and you may have more cramping too.
Okay.
So ibuprofen will help with that.
Which you can take again
Yeah,
after?
yes,
Okay.
you're right, which you
Okay.
can take after delivery. Now, you may notice after you've been sleeping, probably not all night,
For a couple hours,
Couple
maybe if you're
hours.
lucky.
or if you're taking a nap and you get up, you may have normal bleeding
Uh-huh.
after, or a lot more bleeding after that. Because if you think about it, the blood is just sitting there.
Yeah.
And the heaviest bleeding is in the first 2 weeks after delivery. Now, you may like saturate a pad, but we get concerned if you have it for a prolonged period of time, so like greater than 1 to 2 hours.
Okay.
Then we get concerned that there's something else going on. So it's more episodic bleeding.
Okay.
After the first 2 weeks, you may continue to have bleeding, but it's not heavy,
Mhm.
all right? And that actually may continue up to 8 weeks after delivery. After 8 weeks, I get concerned there's something else going on, so I'll have patients call me if it continues after 8 weeks. Around 6 weeks, up to 28% of women may still have bleeding, but normally that resolves by 8 weeks.
Okay. And the other point I wanted to bring up, because I swear my friends and I send each other, I have a couple of friends who are also pregnant, one who just delivered, and we would send each other screenshots of the random emails that we would get from the different apps and what have you.
Oh, uh-huh.
And I think all of us would say that every single app sent us something about perineal massage. And I don't even know if I'm saying it correctly, but it is, is there any evidence that it works for anything?
I'm not exactly sure
Uh-huh.
if it actually works. We do try to do it at the time of delivery.
Uh-huh. And what is it? I'm so sorry. I should probably start with that.
It's basically massaging the muscles down below, the pelvic floor muscles that we talked about, to help them stretch out before delivery. And I don't think the data on it's quite exact if it helps or not. But if it doesn't hurt, you could do it if you want.
Yeah.
That's my suggestion.
There are some really interesting suggestions out there with some of those apps. So anyway, so yeah, I should show you some
Yeah,
screenshots
yeah.
of that later. They're fabulous. All right, so we've gotten that covered. Moving on to legs.
Can I jump in?
Yeah.
So our friend Amy had a question. She said, is it normal to lose a lot of hair, all caps? So I'm thinking maybe a little bit more than, a little bit. Like, what's too much hair to lose?
I get concerned if you're losing it in like a balding spot. That's when I get concerned there's something else going on. It's a lot of hair. It is a lot of hair. But I would get concerned if you're losing it, like if you're balding in one area. Then we need to look at something else.
Okay. All right. Well, let's see. Legs.
Mm-hmm.
I think the two things I've noticed about my legs. One, my muscles are super tight, but you're carrying a lot more.
You
so it's
are.
logical.
Uh-huh.
And then the other thing, and I have a remedy, and I did not run this by you for any medical verification, but for leg cramps that I will swear by. But Charlie horses were a big thing for me. Second trimester and into the start of the third.
Mm-hmm.
I would drink an electrolyte drink right around 4 or 5 o'clock at night, and I have not had a one since. Now, who knows? It could be timing. I don't know. Maybe they're just gone. But I have not had an issue since I started doing that.
I've had a lot of patients take magnesium oxide as a supplement to help with that, and it seems to help. I think intuitively that there's probably, you're drinking tons of fluids, you're trying to increase your blood volume to bring the baby nutrients. So, and we do see some changes, some normal changes in pregnancy, lab changes that occur. So my guess is it may be helping. It really may be.
So the Charlie horses those leg cramps, they get better.
Yeah, they'll get better. Mm-hmm.
And on to my favorite topic, and the one that has caused me I'll say the greatest amount of stress in all of this is looking at my shoe collection, my pre-pregnancy shoe collection. Should I just put everything on eBay now, or will your feet? Let's talk about feet. Right now, I'm wearing flip-flops. I have 2 pairs of shoes that fit. One is a pair of ballet flats, and one is a pair of flip-flops that my husband generously gifted me for Mother's Day.
Aww.
Who knew it would be such a smart gift? But that's it.
Everybody's different.
Okay.
So what happens is the arches of your feet may drop just because of the increased weight from pregnancy, and because of that you may notice your feet get bigger.
Okay.
But everybody's different. Some patients are still able to wear their same shoe size. Some are able to go back to their shoe size and just kind of...
So you're saying there's a chance.
There's a chance.
Oh, that's so
There's
exciting.
a chance.
That's so exciting. Okay. So that's feet. I think is there anything we haven't covered in terms of...
I remember teeth was one of those. My dentist was big into making sure I had enough calcium and making sure that, like, I guess gum disease can happen when you're pregnant.
Yeah, you're right. Great question. That made me think of 2 points.
Oh, good.
The first point is bone loss. Okay. During the
I'm sitting up a little
postpartum,
whatever now.
Yeah,
I'm sorry. Just my posture has not gone to pot at this point. I swear, but no, I'm hunched over all the things like that. Yeah.
There is reversible bone loss that occurs in the postpartum period because of breastfeeding, but it is reversible. So that with the teeth, that made me think of that. But the second is during pregnancy, because of the increased estrogen, you may have problems with bleeding gums and gum disease, and that will get better once you deliver, those hormones drop.
Okay.
But periodontal disease, it can be associated with preterm delivery, and so that's why you should still go to your dentist while you're pregnant. That will get better after delivery. It may take a couple of weeks, though.
And I was just remembering from our original conversation about exercise and the physical changes that occur. You were talking about how your back curves differently. And I will say I didn't notice it dramatically until very recently. But now, it is very, very blatant.
And painful.
It is really not comfortable.
Oh my
I
gosh.
have I'm very grateful to have heated seats in my car, but I will just sit in my gym, sit in my seat in the garage. Not I mean the parking garage here, sorry. Not my actual garage.
Like, I'm going to go inside if I'm going to do that.
But just sit there, and that or a heating pad at home or whatever, just to make it a little bit better because of that low back pain.
Yeah.
And so, but is that just, I mean, once you have the baby and your body goes back to somewhat of its new normal, let's say, does the spine curve back?
Yes. For, I would say, a vast majority of people, that doesn't. Now, you may feel it's very common to feel unsteady after delivery in the first couple of weeks, and it's just because your body's very relaxed because of relaxin that's released during pregnancy. And as all of those hormones drop, your body starts getting back to its normal function. And so that normally does get better for patients over the several weeks after delivery. That's not something that lasts long term.
Is there a certain amount of time you have to wait after delivery in order to start working out or walking or doing any kind of exercise again?
So typically in patients who have vaginal deliveries, there's no limitation other than no sexual intercourse because of the laceration that we were talking about. We want to make sure that it heals. And some will say no tub baths because there's a theoretical risk of infection since your cervix is open, but there's really no hardcore data on that. Now, for cesarean sections, if you really look, there's not any data to suggest that you should limit yourself, even with the incision after 2 weeks of delivery. I still tell my patients to not lift anything greater than 10 or 20 pounds after delivery, and I see them back in the office in 2 weeks to make sure the incision's healed to fully release them. No data-free zone, but I feel like with that big incision, sometimes I don't want my marathon runners out running all of a sudden with this fresh incision that has steri strips over it, but typically that's what my recommendations are. Once again, it's really hasn't been completely supported in the literature. And that goes to the postpartum visit. So most doctors will have you come back in the office 2 weeks for a C-section, but for everybody at the 6-week visit.
Okay.
You're supposed to be back to 100% at that time.
No.
Not true.
Okay.
That's the 6-week visit hasn't been really validated in the literature. That's mainly from anecdotal evidence over time, something we've always done. But I do feel like it brings everybody together to not completely release you out into the real world again. But so you can talk to your doctor about certain issues that you may start encountering. So postpartum depression, we can pick that up at that time. It's normal to feel blue, and I know you guys talked about this last time, but in the first 2 weeks after delivery. But if it persists beyond that, we're able to pick that up. The next thing is bleeding that's excessive. I've picked that up as well at the postpartum visit. Is that laceration healed? Can you have sexual intercourse? So that postpartum visit is helpful for that as well. Birth control, we can insert an IUD at that point in time. And so I find the postpartum visit to be helpful for everything and not necessarily just a postpartum visit.
And is there anything, I mean, can you hold your questions until the postpartum visit, or are there any things that you would, and you mentioned excessive bleeding, excessive anything, you should probably call
Fever,
earlier.
yeah, that's great. So fevers, if you're bleeding greater than 2 pads over 2 hours in a row, nausea, vomiting, particularly if you've had a C-section. And a lot of that has to deal with if you had a complication during your delivery. So if you had preeclampsia and you start developing elevated blood pressures, headache, right upper quadrant pain, you need to call your doctor. The other thing too is if you start experiencing like burning when you pee, increased frequency or urgency of urination, there is a higher risk of urinary tract infections after delivery. You shouldn't have to suffer.
Okay. So anything too crazy, call your doctor.
Exactly.
Right. Anything else we're forgetting?
No, I think we
That covers the whole gamut. Oh boy, I'm excited. All right. Well, thank you so much.
Oh,
for
no
joining us.
problem. No
We
problem.
really
Nice to see you
appreciate
guys
it.
again. I'm
Good to see
surprised
you.
to see you.
I know. Well, hey, hopefully you
I gotta
won't be
prepare
surprised
you.
next week. Exactly.
I gotta prepare you
appreciate
for
it.
the next step.
Well, if I am still here, we will be back next week, and there is a very good chance my husband will be joining us.
Oh, exciting.
Tune in for that from a dad's eye view. But if you don't see me here next week, well, then you can assume I've had this baby or lost my mind, one or the other. But until then, have a wonderful weekend. Thanks so much for tuning in. See
Bye,
you later.
guys.